Good afternoon, everyone. My name is Nandini. I work with WRI India, and I'm here to introduce this session. I'm happy to welcome you all to the second workshop aimed at supporting cities to participate in the Nurturing Neighbourhoods Challenge, which was recently launched by the Ministry of Housing and Urban Affairs. This challenge will focus on developing and scaling neighbourhood-level solutions to enhance the health and well-being of our youngest urban residents, that is, children aged 0 to 5 years old and their families. We are now in phase 1. An open call for applications has been issued to cities, and one objective of this workshop series is to support Indian cities with their applications. And through the series, another objective that we have is also to share the experiences of lighthouse cities in India and globally, those that have led the way in shaping early childhood-friendly neighborhoods. Last week, we heard from the cities of Tirana, Albania, and Pune in India, and this week we're excited to hear about the transformations taking place in 3 more cities. A big thank you to all our esteemed guest speakers for joining us today. We are honored that, I'm just going to switch my move to the agenda so you can all see. We are honored that Mr. Lal Chhandama, Director of Smart Cities Mission, Ministry of Housing and Urban Affairs, has joined us to give the welcome address. And we're pleased to welcome Ms. Claudia de Freitas Vidigal, Brazil representative, Bernard Van Leer Foundation, and Mr. Ashish Ghorpade, Deputy Director of ICLEI South Asia, who will be presenting on the pioneering changes taking place in the Brazilian cities of Boa Vista and Recife, and then in the Indian city of Udaipur, India. Following the presentations from cities, that's in the first half hour of the session, we will then move to speak about the Nurturing Neighbourhoods Challenge application. So Mr. Sree Kumaraswamy, Head of Integrated Transport at WRI India, will present on the requirements of the challenge application and how cities can get started preparing their submissions. We'll then have 10 to 15 minutes for Q&A, and during that session, we invite you to post your questions in the Q&A box. Please avoid typing them in the private chat, and if your question is directed to a specific person, do note that in the comment, and we'll shortlist audience questions for the speakers. And then finally, Ms. Rushda Majeed, India representative for the Bernard Van Leer Foundation, will be sharing closing remarks before we end the session. And with that, I would like to invite Mr. Lal Chhandama, the Director of the Smart Cities Mission, to share his opening
remarks. Thank you and good afternoon, everyone. As we are all aware, the Ministry of Housing and Urban Affairs, Government of India has launched the Nurturing Neighbourhoods Challenge on 4th of November to shape cities that work for young children and their caregivers. Young children need access to health-promoting urban environments close to their homes during the period of their peak brain development. In India, about 19% of urban children below 6 years reside in the slums. More than 1 in every 4 deaths of children under 5 are directly or indirectly related to environmental risk. According to the National Crime Records Bureau, almost 43 children die in road accidents across the country each day. Our cities are facing many such issues related to the health and well-being of young children. Through this challenge, cities will receive support to develop solutions that improve the quality of life of their youngest citizens. This challenge encourages cities to propose interventions in multiple domains, such as safe and walkable streets, reimagining parks and open spaces, adapting public spaces with early childhood amenities, and improving access to early childhood services. Focusing on the neighborhood as a module will help to test quick interventions and scale up strategies across the city. Cities can incorporate interventions to address the needs of young children in the ongoing projects and build on solutions identified under other challenges and programs to multiply the benefits. Cities may also draw on insights from COVID-19 related interventions. The pandemic has underscored the need for walkable neighborhoods where daily trips are safer and more convenient. The transition to neighborhoods that support the health of young children and their caregivers demands a paradigm shift in how we approach city planning, design, and management in India. The challenge application is designed to sensitize and build the capacity of cities to begin adopting the early childhood lens. Cities are encouraged to fill these applications by conducting joint discussions with stakeholders and to reach out to the help desk for any assistance. We look forward to your active participation and request you to make use of this opportunity to create better cities for the future. Thank you, everyone, and I wish you all the best. Thank you.
Thank you very much, sir. We will now invite Ms. Claudia Vidigal to give her presentation. Mayank, could you give her the speaker access?
Yeah, she has the access. She just needs to switch on the speaker.
Okay.
Hey, yeah. You can hear me, right?
Yes, we can hear you.
You're on.
So thank you, everyone. Thank you for the invitation and for having me. It's an honor to participate of this amazing challenge. We're trying to learn a little bit with India, and I think this is an opportunity also for us to share a little bit of what is happening in the Urban 95 initiative here in Brazil. I'm Claudia Vidigal. I am the country representative for the Bernardo van Leer Foundation. I'm a social psychologist, and for the last 20 years, I've been promoting and defending the rights of children in Brazil. My last position was as National Secretary for the Rights of Children and Adolescents in Brazil. And at this time, we are running the Urban 95 initiative, and we decided to highlight 2 cities so we could share a little bit of what is happening as inspirational resource for you, and also for some step-by-step procedures that might be interesting for you to learn. So if I could share my screen, I don't have the share screen button available for me at this time. Yes, thank you. Getting ready. Can you see my screen already?
Yes, we can see it.
Yes. Okay, just a second. Let us set this here. Okay, thank you very much. So this is just a quick, of course, you probably know a little bit about this, but we're part of this bigger initiative in 7 countries, and we're talking from Brazil. This is 6 in the morning here in Brazil. We're in the beginning of the day here. So we'd like to invite you to travel a little bit to our country this morning, see our children. These are our children in Recife. And this is our country, this is Brazil, and the cities I'm going to share a little bit about are Boa Vista, just so you have a sense of where. Boa Vista stays up in the north of the country, right in the border with Venezuela. We do have a refugee situation, super difficult to be managed, but I think we're finding some solutions there within the municipality. And also we're going to share a little bit about Recife, which is in the East Coast, as you can see in blue there. These are the pioneering cities. These are the cities where we learned a lot: Boa Vista, Recife, and São Paulo. And I must say that in São Paulo, our main partner is WRI here in Brazil. It's been great to work with WRI. So many successes have been happening in Brazil, in São Paulo, and hopefully I'll have the chance to share a little bit about this sometime. And these are the new cities. We also have, we didn't call it a challenge, but we do have some new cities arriving. So we have 11 cities joining the Urban 95 network, and they are throughout the whole country. So as a concept, we understand that every opportunity to interact is an opportunity. This can play an important role promoting positive interactions, as was just said in the very beginning. And yes, we need to find our opportunities to create interaction. So this is what should be in our minds all the time when we're planning interventions. What we want is to promote positive interactions. Just, okay. And these are the interactions we can build. These are the connections between neurons, between child and caregiver, between caregivers themselves, between children, between caregivers and children with their surrounding space, And I will focus a little bit on this one because I really understand, of course, we have paint and we have nature. These are super simple things. And these are the requests that the children do when we ask them, what do you want? This is what they ask. They want more flowers, they want more trees, they want grass, they want water to play, they want color. So I think that this is not that hard. So I really believe, as in the opening session, in the very beginning of this session, it was said, it's simple. Sometimes simple things make a big difference. And when we find those simple solutions, we can scale those to many other places and neighborhoods. But how do we do this? We do this by having leaders who really want to make this happen. So these are the two mayors that I'm presenting here for you today. This is Teresa Surita. She's the mayor of Boa Vista, and she has decided that Boa Vista would be the capital of early childhood development in Brazil. And that's what she's been doing for the last 4 years. So it's not, of course, we're looking for quick wins, but we're also looking for a strategic view that will make a difference through the long haul, right? So she started with the quick wins, but she continued. She made this happen throughout these 4 years of her work. And this is Geraldo Júlio. He's the mayor of Recife, in a capacity building session in Boston. And right after this session, he came back to his city. He called all the chiefs of departments. And this is the meeting where he called everyone and he said, this is the most important meeting. Our city better for the babies, for the toddlers, for the children. So pay attention, because we do not have a lot of money. We do not have a lot of financial resources. We need to be smart to map and track opportunities within the investments that we are already planning to do in the city. So I think this is super smart for us to understand that if we wear the lenses of early childhood development, we can find opportunities within the transport department, mobility department, green department, education, health, social development, and so on. For that, he started this intersectoral committee that was going to meet every 15 days to decide where to track the opportunities and address the opportunities. Sometimes they want to do something different. For example, in a street, they do have some budget for street remodeling, but how do we prioritize? How do we find what are the streets that we're going to prioritize? If we want to prioritize babies and caregivers, we need to have some data on them. We need to understand where they are, what is happening to them, what are the services that they're being offered or not. We need to understand how they move and how they stay in the city. Do they stay in these public spaces? Where are the public spaces they're looking for? What are the areas and the neighborhood that they cannot find a place to be? So they need to transport to a big park or to another green area far away. Also services and programs, because if the services and programs are not in the neighborhood or not in the neighborhood right beside, it's too hard for the mothers and the fathers with their babies to move around the city. So it's important for us to understand where they are, where are the babies, where are the services, and most of all, where are the risks and the opportunities for us to track. So that's what Geraldo Júlio did, and also Teresa. This is the map of Boa Vista, and all these trees that you see, they are a bit of a play game that Teresa did with the city, because these trees are not trees, they are babies. So she wanted to understand where the babies are, and every time there was a baby being born, she put a tree so she could see where the forests were. And in those areas, she wanted the city to be greener and with more services and with more opportunities. So with that data, they invited the community to participate, and they wanted the community to tell what they wanted for the neighborhood. So they had open sessions with community, sometimes just inviting them, sometimes offering, for in this one, for example, it was a massage workshop, a Chhandama workshop probably they learned with you a little bit of this Chhandama, and we're trying to implement it here. And then the families start coming and participating and taking part of this whole remodeling of the neighborhood. That makes a whole of a difference because now they feel responsible for it too. And of course, this is already what happened. So these are some areas. I'm sorry I didn't share, I should have, in this one, the before and after. This was a street of, it was earth in the street. There was no sidewalk, and this is a services. This is a health center. So all the interventions that Boa Vista did, they prioritized the services they had and the surroundings of the services, so they could have these surroundings more comfortable, safer, and a little more playful. And also in the mobility side, right? Of course, they didn't have the budget and the money to do all the bus stops like these ones that you see with all these colorful areas and seating areas. And some of them even have air conditioning today because Boa Vista is super, super hot. But how do you prioritize? If you have the budget to do 1, 2, 3 with air conditioning, who are you going to serve? How do you choose where is the best bus stop in your city? Is it in front of a health center, or is it in front of a corporate center where all the men and women are coming and going to work? So usually we used to prioritize all this, come and go from work. We wouldn't think of the families as the center of the mobility, comfort, safety, and playful interactions. Of course, it's not only for the babies or only for the families, but we need to take a look at those services and see how they're moving and how can we serve them better. So I think these are some hints that we use for us to plan an intervention in the neighborhood. Always look at comfort, safety, and play opportunities. This is what is going to promote the positive interaction, because if it's too much uncomfortable, so if the person is not comfortable, don't make you comfortable out there. Maybe it's too hard to have a positive interaction, and you just want to go through the system. It's like if you go to a health center for a vaccine, it could be a journey of learning and interactions, or I need to survive this, right? I need to get there alive because the cars are so fast and the quality of the air and so on. So this is our goal, to make it journeys. Sometimes you need to change the route. Sometimes you need to plant trees. Sometimes you need to put some play opportunities, simple ones. And I think it's interesting for us to think about changing routes, because sometimes we go like, okay, this avenue is like full of trucks and cars, a lot of bad air condition. So sometimes you just need to change the route and try to find a second route so the babies and the toddlers can find a nicer way to move throughout the city. This is still Boa Vista, and I'm finishing Boa Vista to move a little bit to Recife. And this is what Teresa called Selvinha, this jaguar. She had some of these big animals. She decided to invest some important budget in these tactical interventions because the population was so excited about visiting the jaguar, visiting the alligator, visiting the tattoo, that she invested in that. And that is what made all the community actually go to the green spaces. Sometimes we just do not have the culture, and we need to create the culture, and then we can leave it for the population. So the tactical interventions can serve this because people are super interested in climbing the jaguar and so on, but also some activities. Here you have the baby spa. They even have a big bathtub where the babies can bath and have a spa day for the babies. Of course, it's a little bit of fun. It's not like a public policy having a baby spa, but it's the way for us to call attention, and so the community get engaged and start going to these places, because sometimes you invest in the infrastructure and you balance between engaging the community and also investing in infrastructure is something that we should always look for and try to achieve a good balance. This is still Boa Vista. They're holding a party in the Green Park. You can see the pregnant women back there. This park was always empty before. There was nobody there. The way they started doing some musical shows and theater shows just for 3 months. They had like this every Sunday theater show. So the community started to go. So when the shows were not there anymore as often, the community was already there and they started to do the show themselves, parties and gatherings and picnics and so on. And this right picture is the one of the open streets in Boa Vista. They have some streets that close for cars and are open just for kids for the weekends. This is a culture that is happening a lot in Brazil, in many different cities. As we know, the streets are the main urban space that we have, and sometimes we have to claim them back for children, sometimes only for the weekend. Sometimes some streets are being closed for good for some communities. And also we do have some laws. So for example, in Boa Vista, there is a law that if 50% of a neighborhood signs up, of the street, I'm sorry, about that street, signs up for closing streets on a Saturday, on a Sunday, this can happen and the municipality will offer just a little bit of support and the community does it themselves. So this is happening very often. And this is Recife. I'm just going to share a little bit about the plans in Recife. Also, there were so many poor communities and vulnerable communities for us to invest. It was really hard to understand where would be the best place to start. And I think a good hint is to start by looking at the services that we have in the surroundings, and maybe the services can serve as a center from where the routes can move and spread out. So here you have a neighborhood with some different services, and we planned the interventions around and surrounding these services. Because proximity matters, so you need to do the interventions close to where the families are already interacting. This is the Mais Vida nos Morros. It's a project in Recife. It's basically in the slums, but not only. We also work in some like mid-class communities. And the idea was just to cheering up the communities with color and of course with some safety procedures. As you can see, there are ladders that weren't there anymore, and also bodyguards, I'm not sure if that's the right word, but this orange piece that can support children to play, because this was a very, very dangerous place and children used to play there a little bit, but super dangerous. When you put this safety component, you have all the families happy to see those kids going there. These are the plans. As you see, the entrega in Portuguese means delivery. So it's supposed to be delivered the day after tomorrow. So we're almost getting there. These are the people are working at this. It's just so you have an idea. And of course, when you see the project is like this, when you go to reality, it's not exactly like that. Of course, this is the reality. So this is our kids, some areas that are already done. As you see in this one, it's just painting the streets, putting some components for safety. And then you have some place to sit, comfort, safety, and playful activities and opportunities. Also Mais Vida nos Morros, and I chose to actually share some pictures with you because I think this can bring good ideas. And you can see in this picture painting on the floor, the community painted the whole streets, and this was a very successful initiative. In one of the interventions, we had more than 2,000 volunteers. The communities want their neighborhoods to be better, to be more beautiful. They want the children to participate, and the children are always, of course, the bigger ones, not the babies like those ones, but the children 7 years old, 8, they are the ones who always receive people in the neighborhoods in Recife. Let me just check my time here. I'm almost done, okay? So this is still some pictures from Recife. And I didn't want to finish without sharing with you that India, special thanks for the Ministry of Housing and Urban Affairs and partners for the guidelines you have created. In case you don't know yet, India has all these guidelines of policy on programs and services, monitoring and evaluation, good ideas, best practices in interventions in the neighborhoods. We felt like those guys were so good that we decided to translate it to Portuguese to adapt. And now they're being used for the whole Urban 95 network. The new Urban 95 network is getting to know those guidelines and will benefit from that. So I wanted to finish my presentation. Thank you so much for the learnings we already had with you. And of course, I'm open and also, so this is election week for municipal in Brazil. We are in the middle of the elections. So hopefully you will have some more time for us to meet with the new mayors that are coming and they later on. Thank you, Nadine.
Thank you so much, Claudia. That was, I think you covered so much ground there to talking about, the importance of leadership, to stakeholder engagement and simple solutions. Hopefully everybody's minds are buzzing with the ideas now, so appreciate that. Thank you. And next, we would love to invite Mr. Ashish Ghorpade, Deputy Director of ICLEI South Asia, to present about the transformational work happening in Udaipur.
Thank you, Nandini, and I think thank you to the Ministry, BVLF, and WRI for having us here and giving Udaipur a chance to present. I think we had a very nice overview from Mr. Chhandama and a very interesting presentation from Claudia. It's difficult to follow up on this, but I will try and see how I can add to what has already been talked from the point of view of some interventions that we have attempted in Udaipur. I hope my slides are visible now. Great.
Yeah.
So I think without talking much, I'm just trying to share experiences from implementing projects in the city of Udaipur, which is an urban 95 city. And over a year in the city with support from the municipal corporation, definitely the Bernard Bandlia Foundation, we as ICLEI are implementing the program wherein we have over the year through a number of activities being able to identify tactical interventions that we would be implementing in the city and also a set of pilot interventions. So as the program, the Urban 95, for deciding these interventions, we went through a lot of research and assessment on ground in the city to understand the conditions of services, facilities for young children and their caregivers, basis which we should be able to identify the kind of interventions we would want to implement in the cities. And because it is a large city, we decided that we would intervene for an example case in two ward areas, a group of wards in the ABD area and one ward in the Pan City area to be able to study and understand what the context is like. And based on our findings, we developed projects that could be implemented on ground in the city. Tactical interventions, 6 in numbers, and 4 pilot interventions, which are at a stage of designing being done and implementation to be taken up in future in coming time. Together with that, there were a number of capacity building activities also, but I think for today's presentation, it would be interesting to share with you our experiences implementing the tactical projects. So in this slide, you see the 6 tactical interventions that were developed for the city. The 4 on the top are the ones that I will share details on. They got implemented in the city. The first images of an intervention that looked at traffic calming in an area which had schools and schools for young children. And we felt that it would be interesting to show the city how the safety component for young children could be brought in to improving the road conditions in that area. I'll tell you more about this. The second picture that you see is of an area, a common area, public space that is enclosed by housings. And this space was in a very sad situation as of when we identified this. And through our tactical, we tried to revitalize the space by bringing in components that I'll tell you more about, and see that a big difference can be made to how a place is thought of if we were to put in some effort and try and change the way we want to see it in the city. The third image is of a park that was in a very situation that was I should say not used because of lack of upkeep. And with the city, we then improved it and rejuvenated it for the citizens to appreciate and use it better. The fourth intervention that you see is also of a park, but we improved the park and we organized a festival for young children over 2 days to show the city that we have a large group of young citizens in the city who benefited to a large extent if we were to make changes in the way we think of our cities. Two images that you see at the bottom are areas within an Anganwadi and a primary healthcare center that we thought of improving, especially the outer areas for better use by young children, but also by caregivers as they come to leave their children and probably spend some time waiting, picking up kids or dropping them off at Anganwadis, or while they're showing them to the doctors while they're visiting primary health centers. So overall, the approach that was followed for all of our tactical interventions was this, wherein we spent some time identifying sites, locations where we will be able to implement these projects. A group of such sites would be identified, and then through detailed stakeholder engagement involving officials of the municipal corporation, BVLF, as well as some local representatives, we would decide on a site that was good to be taken up as a tactical. And then we would design the intervention in terms of what change we want to make. And once we had some idea of what we wanted to implement, we go back to the stakeholders to show them that this is the kind of change that we want to make to this site, and what are their opinions and what are their thinkings, and whether they want certain more elements to be added to how we are thinking of this location to change. Based on that, then we would prepare ourselves for implementing the tactical, which would involve material procurement, but also interactions with volunteers or groups that would help us implement the pilot, and then go ahead and implement it on site. While we implement it on site, we would have city officials as well as media people come in to see what we were doing and how we were doing it. And that, the implementation once done, the changes that it brings into the community, its usage, we would document through photographs, through videos, through surveys, which would go in as documentation for how what we are attempting to do is changing the usage and the perception of people who are using these places. Basis that, of course, we would talk about scaling up opportunities, looking at similar projects in the city overall, and how we could take it further. The next slide, I think now I go into details of each of the interventions that we did. This is a photomontage showing you the steps that were followed in pictures. If we are talking about the tactical intervention of traffic calming at the Vidya Bhavan school area, we identified the site, we decided on the kind of changes that we wanted to make. We had a lot of interactions with the community, and then got prepared with material, with volunteers being prepared for the site, and then going ahead and preparing the site for intervention. More pictures of interactions with the community, but also site preparation that would be required, early morning hours, late evening hours, so that we do not interfere with the traffic movement on the road, and then getting the site to actually change. You see pictures of the mayor and the commissioner, traffic officials, traffic police officials joining us. I want to point to the central picture in this montage. It shows usage of masks and gloves by workers, because safety is important. And I think all of our interventions focused on this much before the current normal, where almost everybody is thinking about using these. And this is the kind of a change that we saw on ground, implemented and for people to use. It was appreciated in a big way by the citizens, by the media and users, and a lot of feedback was received in terms of how we could do this in other areas, how we could improve this in the area that we were implementing it itself. Another intervention that we did in Udaipur is the Nayo Ki Talai Chowk, the revitalization of public space that we did. And this is the concept that we developed. It was a triangular plot that we had, site that we had, and we thought that we would try and design it and bring in the space for usage by young children and their families, but also make space for parking, which was being haphazardly done all over the plot of land that we were working with. So as usual, a lot of interactions with the community to get them on board. You see in the pictures municipal officials, but also the deputy mayor, who actively participated in a number of discussions, visited the site on regular basis, informed the citizens what we were wanting to do, and then getting started on cleaning up the site. You see pictures of the site as it were in the lower pictures, lower images. These really needed attention. And of course, getting involved with the community, young students from schools, volunteers, to actually implement the tactical as we had envisaged it, which involved a lot of painting, cleaning, and involvement of also municipal staff to help us execute some civil work, which was required to make this place become the way we wanted it to become. We had visitors on a regular basis, of course, from the foundation people coming in, but also from the municipal corporation, school teachers, young students, young kids coming in to contribute with their own, brush and paint and hand marks on what we were attempting to do. And it was a very interesting experience in itself. This is the aerial view of the site when it got implemented. So the concept was Ghar Aangan Sansar. We wanted to develop it as a courtyard surrounded by housings, but also had a temple nearby, which was improved and decorated. And once it was implemented, it was something like this that you saw transformed completely and very well appreciated by the community, by people in the vicinity who had young children, who had also others such as elderly and women, to see a space that seemed like a waste area become something that could be appreciated and enjoyed on a regular basis. It was documented very well, covered very well by the press, but we got a lot of feedback and requests from citizens asking us if we could, together with the municipal corporation, implement similar measures in their own communities as well, which was noted down, and we hope to take this further as we go into future implementation of the Urban 95 program. These are interesting pictures. They tell you what was and what it became after the intervention. You can see, pictures tell you what was the change that we brought in. This is the temple after its repainting. These are spaces on the sides, which were waste areas, really became very active and beautiful, and people started to use them. Another intervention that we did is the revitalization of the Mira Park. This is a park across 3 levels, and we worked only on 1 level of the park. And we found out that this park has not been used by community and citizens who are living around there because it has not been maintained, and it is in a situation that people feel hazardous to go there. A lot of stray dogs, a lot of overgrown grass, lights not working, the equipment that was put up for kids to play not in a state that could be used by young children and such. And so with the municipal corporation, we decided to revitalize this and get it to become something that will be used by the young children. So of course, a lot of interactions in deciding the site and trying to explain what we would do, how we would do it, not only with the municipal officials, but also with the community. The last picture that you see is a picture from a community center where we had the residents come in and we showed them what we wanted to do and took their feedback on how we could do this, and then go ahead into actual implementation, which began with cleaning up the site, making marks, and bringing in material for implementation. In the pictures on the current slide, you see how this was implemented. We had a lot of volunteers come down on ground with us who helped us transform the site from what it was to what we wanted it to become, and a lot of colors and material, bright material that was used to be able to make the park become something that would be attractive to young children. You can see in this slide the stages of development of the park. This is what it became, had a lot of interesting rides and play components added, including a sand pit for young children. And this was something that was really appreciated by the residents. We saw an increase in footfall. We saw a lot of young children regularly coming to the park. And this, even though initially was thought of as a tactical intervention, became something that would last longer. Also, a lot of coverage by the press and talking about this as an example of how we could make rest of the parks in the city also become usable by children, and questions asked to the municipal corporation about when they are planning to take up similar activities for rest of the parks. And this was very well appreciated. These are pictures of before and after status. You can see for yourself what it was and how we changed the condition as we implemented this intervention. So like Claudia said, colors make a lot of difference. And another very interesting intervention that we did was picking up another park, following up from citizens' requests to look at other parks that could be improved. We picked up Manikyavar Lal Verma Park for improvement, but together with it, we added a component of organizing a kids festival, which lasted 2 days, and we had kids from the two group of wards come down and appreciate the park, which was rejuvenated, but we also added a lot of activities that they could be part of over the 2 days to see and enjoy and learn in an open space the kind of things that are possible for young people. This intervention was appreciated very much in Udaipur because nothing like this had been done in the past, and the fact that the corporation was doing it and doing it at such a scale, it was really appreciated, not only by young children, caregivers, but also people who were running schools for young children and such, saying that this is a very good idea and this should be taken further. Of course, for the intervention to really happen, we had a lot of interactions with the municipal officials, talking about how we could do things and what could be done, what needed improvement and how we could improve it. And you can see workers from the municipal corporation side helping us on improving the look of the place, redoing civil work as well as paint jobs to make the park look better. This was a large site, so required a lot of planning in terms of how we were improving it and also how we were organizing the entire festival. And this is the aerial view of the park after the intervention was done, with a lot of color and decoration added on site with the improvements that were made on civil works and such. We had upwards of 1,000 kids and additional caregivers join in. Many Anganwadi groups also joined us. And all of this was only possible with many volunteers that worked with us to get things done on ground. And yes, like I said, it was covered by the media in a big way in the city, and it showed the citizens as well as also municipal officials who had already started to believe that there was need to look at young children's needs, that there is demand and there are people who would benefit and appreciate this kind of a transformation in the city, definitely. These are before after pictures of site improvements that were done in the park as we were inaugurating the festival. And these are some pictures that I did not share with you earlier, showing pictures showing kids enjoying the locations and the changes that were made. We have a treasure trove of pictures which show kids appreciating these places. But paucity of time, I only share a few slides showing pictures where kids are enjoying the places that we created under the program. Just some more additional pictures of planned interventions that we wanted to make in the Anganwadi. And this is the site. We had land around the Anganwadi that could be improved. And so design was made on how we could make it interactive and usable by young children, and also get it implemented in time. Due to COVID, implementation of these interventions did not take place yet, but this is on the cards, and we will soon be seeing this getting implemented on ground. Another intervention plan for a primary health center at Pula, land available around it, which was not being used. You can see a picture, the first picture, caregivers just sitting outside waiting for their turn in the PHC. We thought that we could improve the space for young children in a way that they could wait in a better environment, but they could enjoy the waiting time as well. And we hope to get this implemented in coming time. Just some pictures of pilot projects, part of the Smart City mission that are going to be implemented in the city. All of these pilot projects have been detailed, designs worked out, material specifications identified, as well as costing looked at, and we hope to take it further into the implementation stage in coming time. Some images of how we are hoping to get implementation to happen on ground. I want to mention that these pictures and this information that I have shared is probably limited. If you are interested, you can refer to the UMC website. There are links to all the work done in the city, which provides documentation of work conducted in Udaipur city. And this might be very useful for anybody who's interested to know more about what was undertaken. And I stop here. Thank you so much.
Thank you very much, Ashish. This is a really visual kaleidoscope of the work that's happening in Udaipur, and I think that's very inspiring for us to see happening in Indian cities. Before we move into talking about the application, we wanted to just do a quick call just to get a pulse of the room also. So I'm going to run this on your screens now. This is to looking ahead. Hopefully everybody can see this. Hopefully you can see the poll question now. But essentially we want to get a sense of looking ahead at the Nurturing Neighbourhoods Challenge and thinking about the types of projects that are ongoing in your cities. Which are the domains where you see there being the most scope for introducing interventions related to that are designed specifically for young children and their families? If you can select the top two from your perspective, we'll just leave this open for a couple of minutes and then share the results with everyone. Like, apologies if you couldn't hear me before. I'm having some sound issues with my mic, but we will close the call in another 20 seconds. So if you haven't selected anything yet, please do weigh in. We'd love to get a sense of what cities are thinking about in terms of where there's scope in your existing and ongoing projects to introduce interventions designed for young children and their families. Close this and share the results. Okay. Hopefully, I'm not sure if everybody can see these results. I'm just trying to share them with them. So I yeah, might need to take a second to do this. So why don't we move into the presentation, and then we can share the results of this at the end. But wanted to just get everyone thinking about this because now we're starting to look at take a closer look at the application process for the Nurturing Neighbourhoods Challenge. So I'd just like to ask Sree Kumaraswamy from WRI India to share his screen.
Yeah. Okay, I can see.
Yeah.
Yeah. Thanks everyone for joining this workshop. Once again, thanks to Ministry of Housing and Urban Affairs program and for to Bernard Van Leer Foundation to support this and making it happen. And this today, I think this I'll quickly help to orient towards the application, how we are doing this and how to apply for this, and what are the steps and how the application is, how I'll go through each and every question and how city can apply. Before that, I think considering that many of the new people who new cities who couldn't join this workshop would like to little bit orient towards to help them kind of give the context, and then quickly we will get on to the looking at the application, right? So just to give the challenge, the main objectives of the challenge, we are looking at promoting early childhood development across the cities by working with the municipal corporations, local governments, smart city agencies, development authorities, any of these agencies in the officials working here, how to work with them to kind of take this idea of early childhood development across the country. That means why we are saying is that even the last presentation we had an elaborate session on this, is that during the first 5 years, the most of the neural connections in the brain of a child happens, most of the things happen during the time, the connections. Therefore, it's very important at the formative age, and that's why we want to focus on, and considering Indian cities are, we have the, as the director mentioned, we have the highest population of young children, and we will have to really take that seriously to look at how cities need to be planned towards that, right? And then looking at how to pilot projects and how to catalyze them to long-term implementation, and then kind of how to measure the impact, how much are they helping people, and then create best practices, and then use that to create kind of a network of champions across the country who will keep doing this kind of projects going forward. Right? How the challenge is planned. This is a 3-year kind of a initiative. First, right now we are in the first phase of requesting cities to apply. The application will be open till January, mid of Jan. And then from the application, 20 cities, a cohort of 20 cities will be selected. And from February onwards, we'll be working with those cities for around 6 months and try to implement the projects on ground and kind of prepare certain technical taking the projects forward, and capacity building, and also connecting with the peer-to-peer cities. And then going forward, I think 10 cities from there, and then work with this 10 cities for next 2 years to give a more deep engagement. Right? Agencies,
Sree, may I just pause you for a second there, Sree?
Sorry?
Sree, may I just pause you for a second here, Sree? Your voice is breaking and there's some background noise. Can we just take a few seconds to have this fixed, please?
Okay. Okay, hope it's better now. And so here the cities are the mains. So the eligibility of the cities, we are looking at 5, any city which is above population, and all the smart cities and all the capitals of states and union territories, right? So any agency which is involved in in any of the development works and providing services, they can be the applicant. So there can be multiple agencies also can be participating, can come together to form partnerships. So coming to the application, just I will talk a little bit about how the application is. What are the main objectives we have planned? So one of the main objectives is to a little bit take this idea to all the cities who are wanting to participate in this. So therefore, it's a more a kind of a ideating around and building capacity around thinking through this in a city's perspective. What kind of projects can be done? What kind of development? How. That is the main focus. Activities happen within a neighborhood, within a walking distance from their home, and where they access their services like Anganwadis, health centers, parks, gardens, little bus stops. So these are how to let neighborhood as an important module. Then looking at data-driven decision making, and then looking at behavior change as an important aspect of creating these projects, right? For example, we do a lot of physical development projects, but how are they really implementing? The implementation is impacting the users, right? The people who are using it, the children, how are they really getting advantaged? So what are those key behaviors in the behavior of the users, the children, the municipal corporation, the other service providers? So how to frame that thought of behavior change from the front, right? And then looking at how to create a momentum on ground, doing through a quick action oriented approach, where we identify quick wins and going forward from there. Okay, so all the material related to the challenge are available in the challenge website, and you will find all the material there, and from there you will get a apply connection. Then that will connect you to the Amplify portal of the ministry, and here you will be able to. All the smart cities have their credentials, and other cities who do not have their credentials, they can write to us and can get the credentials. And once you go there, you have this nurturing neighborhood challenge. Through that, you can enter into the application. So the application appears like this. Instructions. This is the instructions page. You have all the information required for the instructions for the application is provided here. You'll be able to access that. And for example, this is the structure of the application. These are the various tabs. These are applicant info, envisioning, then so on. So I will go in detail a little later. So you will see that as you finish each and you will get saying that the application is complete of this stage, and then you will and then it will indicate the complete sections, and then you can go to the next one. And once you finish, you can have a look at the preview of the application, and then you can submit, and you can also download that as a PDF and use it for your reference. And then there is also a baseline data which is in the annexure, which also need to be filled in. Going further, we also have a scorecard which will give an idea of how the evaluation will be done. And there is also the terminologies, a glossary of terminologies which will which provides all the definitions, and that's also very useful. And then there is also FAQs of frequently asked questions, which is also provided. Right? And then going forward, every application, as you go through each of the tabs, there is also, you can save as a draft, and then you can, as you finish each of the tab, you can also finish it and save it. So that will also be useful for you to see. And then as you can see here, every terminology has an explanation which is already provided there. So you can actually have a look at and look at how what the definition is, and it will be very helpful to refer to that. Yeah, so these are the. So now coming to the application structure, just to give an idea of how the entire application is. The applicant information, it is about predominantly information about the agency who is applying, and then there is a visioning section where there's a whole broad idea of in the city is discussed. And then we go next to the identification of pilot solutions. So this is the biggest or the main part of the application, where every city is expected to identify a neighborhood where the pilot projects will be located. And within that neighborhood, 5 pilot projects will be identified. And this is a very broad kind of application. You need not have very detailed design for it. And then once you have it, how the application, how the pilot projects were decided, how they were co-created with the stakeholders, then how the city is planning to implement it, and also to understand what are the similar type of projects the city has done in the recent past, right? So then it's an undertaking by the city agency to submit, and in the annexure, it's about baseline data around young children. We'll also go a little detail later, and you can kind of download and take a look at the application and submit. Okay. So as I said, this application is quite simple. It has a more kind of predominantly it is objective type questions, and there is very minimal need to write very elaborate explanations or kind of explanations around how the narrative of the project, etc., is very less. It's more selecting from the given options and then framing the projects through that, right? So you'll see that in a while, and then there is very less need to, as I said, as an objective type, and there is no need to really prepare a detailed design. So the cities may not need any consultant to really prepare this application. And the application is also, as I said before, more oriented towards giving idea of this young childhood oriented cities. So therefore, there's it need to be seen that way, that you spend more time to really understand and to go through it to see what are the various options of integrating with the city. Right. So the process, so identify neighborhood, collect data, discuss, visit the sites, and then come up with pilots, right? You may need to discuss with the stakeholders also to come up with that. So we'll just go a little bit in detail, each of the questions. Applicant information. So this is very simple. I think predominantly it's about which is the agency and what are the basic details about the agency. And we request to identify one nodal officer per city who will be in charge of preparing the application and will be in contact with the ministry and with the partners. And then looking at some of the key data of population 0 to 5 age group in the city. And then going to the envisioning for early childhood oriented development. We will see that here we are to understand, to arrive at a vision, we actually will have to really understand what are the issues, the problems faced by young children in the city. So therefore, we have kind of listed a certain kind of generic issues. The cities can add additional to this and also write how specific it is for their conditions. So it is, and also cities can prioritize it, how important this issue is, and then using that to really understand how to overcome this, right? And then there is also a point of view from the local government point of view. What are the problems faced by the local government in thinking about young children? Right? What is it the problem of funding? Is it the problem of data? We don't even know where the young children are. Or is it the problem of expertise to create project? Or is it that we don't have institutional setup? Or is it that a general awareness is issue? So just to identify what in the city perspective, what are the problems in understanding this? And then going towards preparing a vision, right? So before preparing a vision, we are requesting to write within 50 words, it's a very small paragraph on the motivation to join this kind of approach. So this is one of the few places where you may need to write a paragraph on why the city agency is motivated towards this. And then there is a vision builder which helps you to prepare, come up with a vision through a certain kind of identifying goals. What are the main goals to achieve? What are the approaches to achieve that, achieve the goals? And what are the strengths? What are the inherent strengths of the city, which the city can build on preparing towards the vision, right? You will see some examples of arriving at a vision to help how a city can arrive at it. Okay, then next we have a vision. And then how this vision is going to be achieved through a series of pilot projects in this given neighborhood. So, we are requesting, the first thing is that requesting a city to identify one neighborhood where all the pilot projects are going to be planned. And here, I think I spoke already regarding how this walking distance to various facilities and then various destinations where a child and a caregiver would go to on a daily basis. This is the domain of where within a neighborhood, and the public domain, the public spaces within this, right? That means streets, public spaces, parks and gardens, anganwadis, facilities. These areas, around these areas. So these are what we are talking at as the main domain of this project. Right. Then going forward, we are requesting to identify neighborhood, then the area and the population, and also identify those vulnerable population, means the population which are in living in conditions which are like informal settlements or in derelict areas, or if any such population in the area. And then identifying some of the data neighborhood, and then we request cities also to identify neighborhoods which are having this multiple types of uses, but at this activities happening in these areas. And also there is a variety of types of population that also helps to identify how the solutions can be specific for the population, right? And so impact benefits all sections of the society, create a variety of solutions, and then also create a positive behavioral impact, right? Now, we said 5 pilot projects. For each of the 5 pilot projects, there is this series of questions which need to be filled in. One is the location, project goal, and which is the solution domain this project is focusing, and then some of the how the city is planning to get it implemented and who is going to benefit, etc. Right? Just to go in detail, so this is the first question on what's the name of the project, where you're going to, how it is located, and how this location can be justified. This is another place where you may need to write some explanation why this location is very significant. And then area of the project, and what is the project goal? What is the overall goal with reference to addressing the 0 to 5-year-old children, right? And then identifying the solution domain, right? I think we have discussed before. These are the 4 solution domains which we are talking. I'll just show it in little detail. So, imagining parks, gardens, and outdoor spaces, play spaces, and then looking at existing public spaces, how to adapt them to incorporate early childhood-oriented amenities. The third is making streets which are connecting to these spaces, how to make them safe and walkable. And then the fourth is to identify early childhood services and doing interventions in the surroundings of the early childhood services. Therefore, it helps access to these services and create a kind of a better public domain, right? So we have this 4 domain, and then we are looking at what are the is this project already planned under any of the mission, such kind of information, and then looking at how this will benefit all the sections of society. Some of these are all simple direct objective type, be able to select, and how this solution is addressing various different types of domains, and then how this multiple components integrated and complementing each other. For example, what we mean multiple components, how this integration means, what does this diverse domains means.
Sree, you are not audible.
In a neighborhood, there is a public space or a park which the city wants to redevelop. But at the same time, even if redeveloping the garden alone is not enough, we need to really talk about how the access to the garden is going to happen, how people are going to walk through the streets. Is it safe enough to walk? How to cross the road? What happens at the junctions? Is it safe enough there? Is there a place to wait? Is there a bus stop? How people can wait space near the bus stop? And how to have a safe conditions over there? We need to look about lighting. We need to look about solid waste management, or how clean the area is. We need to look at how safe it can be made for toilets. Is there nursing facilities, nursing rooms are available for children and the caregiver. Are we having enough shaded areas, for example? So there is various aspects of this which need to be addressed when we talk about this one project. Therefore, all of this need to be integrated together and that's what we say it as one project needs this multiple diverse kind of domains, and also you will therefore will be able to integrate it better and a better solution for all, right? Then going further, looking at how we have these pilot projects which are slightly long term and getting them done, but we need to also create this immediate quick wins, right? Quick wins which will create a momentum on ground where people see visible changes, right? So I think these beautiful examples from Brazil and Udaipur, you saw this creating this momentum on ground through these quick win solutions, easy to implement, going and doing it immediately with very less cost and creating maximum impact, and everybody starts talking about this approach. And then we also would like to understand how city is planning to integrate it as a response. So these are some examples of pilot projects, and I think we've discussed before. So now coming to this, the idea of elements of this, how to understand the various approaches and the elements of the infant toddler caregiver friendly neighborhood. I think Claudia also spoke about this. So this is the Itcn framework, which is available on the ministry website of this, and it is available for cities to refer to. And here there are questions around this just to think through these elements, right? The 5 elements are inclusive, playful, green, safe, and accessible. Right now, what this means for a city and for a solution in a neighborhood, this is what we have provided here in the application, and it is in the form of objective type questions. So for these are the five categories, and also there is a public engagement which also is added, and you will see that for each of these there are 10 questions, and all of these are objective type questions. So it gives an idea to really think through what safe means. For example, this is a question on safety. So what safe means, and how this safety is applied in a pilot project, right? So that is also provided here. So if a city has made a project around enhancing safety in the neighborhood, they can check here. They can click here to say that, okay, project 1 and project 2 addresses the safety. Therefore, this also helps to kind of through the process. There are these 55 questions. While going through these 55 questions, you will also know that how this is linking with the projects the city is planning. So it is, though it is slightly long, but it really gives an idea of understanding what this means, and how to think through it in the pilot projects, right? Then, so with that, the pilot project section is over. Now we are looking at how this, we want to really understand how the city has co-created these solutions, created these pilot project solutions, right? So one is that participation with the related agencies. Any project will require some kind of interdepartment discussions or with other agencies, right? Even if we want to do a street design and we want to improve that, we need multiple agencies involved in, such as, the municipal corporation, if there is a smart city agency, if anything doing there, traffic police. So these kind of multiple agencies have an important role there, and also the users, the NGOs, experts, the public who are using it, how to have some discussion with them to identify some few questions on how the city has discussed with any of these agencies or any of the users. So that is just an objective type question to fill in. And then going forward, thinking about how to implement these pilot solutions, right? So, one of the main requirement is to have a financial understanding of the project. So for each of the pilot project, the city can come up with a very broad block cost that this need not be based on any design or any detailed preparation, but some kind of using thumb rules. Every city have their own way of using thumb rule to calculate how much a project would cost, right? So this is the more at the intent level, how much a city can spend, that kind of a budget, and then also identify what could be the source of funding. And then identifying how the city is planning to implement any of the partnerships which are identified. Does the land belong to the agency itself, or does it belong to some other agency? Any other agency are providing services, or any of the coordination which is required. Therefore, what all the coordination discussions have happened, mentioning that for each of the project would be very useful. And then implementation of pilots, there is also need to do a very long-term kind of a vision to incorporate early childhood oriented approach in the planning and designing of the city, right? So it is not that one-time pilot we do and that is enough. So we will have to really rethink our approach in all that we do, right? Any planning, any development we do, how to rethink our approach, considering young children as a very important aspect. Every has a plan to do the development plan, mobility plan, various other plans, or local area plans or policies. So how a city is planning to take this forward? Probably in the next time when a revision of these plans or any of these plans, policies are going to be prepared, will the city use this as an approach within that, right? So that is the question here. It's again, it's objective type for the cities to select what is their vision of incorporating that. And then how the city is planning to have a dedicated institutional setup, right? Usually we can see many of the urban 95 cities have actually done this of creating a dedicated cell, ITC cell, who will address these issues. So that is going to be really helpful. And then and also maintaining and creating a dedicatory budget. So Pune city is already having planning a dedicatory budget. So that's another interesting thing for implementing ITC related projects. So then going forward, there are some explanations. Then looking at there's a development scenario, just to understand what the city has done similar kind of projects in the last 4 years. So especially the smart cities projects you have identified. What are the similar types of projects which was done in the recent past? Those details of it can be provided, and then the finances for it also, if the information available, would be great. And then there is finally by the city agency. Therefore, there will be this is more a simple undertaking, saying that city will take these projects to be implementing, and this particular tab is available as a PDF. You can download it and get it signed by the head of the agency, and can be uploaded on the portal. And then after doing all of this, the city can download the entire application as a PDF, and it can be used for verification or for record. And then can submit, then hit the submit button, then the application will be submitted. So apart from that, if the city has any support documents or any of the can also be added and submitted. Then going forward, there's an annexure. Especially, I was still saying that how young children oriented data is very less available for our Indian cities, because this has not been considered as a very important aspect. So we have identified few indicators which are very key for understanding life of a young child in a city. These are predominantly data which is already available. The cities need not do any survey or anything. These data are already available in various format and under the ministry's various mission oriented projects or these data oriented projects. This data is already collected. You can compile them and fill it here. Though, I mean, this will be of very, very important use to collect this data of status of young children oriented facilities and how the life of young children in the cities is happening across the country. So this will be of very much useful. And then submitting that, and though this data baseline data is not compulsory, but it is very important that all the cities do submit it. But it will be really useful to understand us in the point of view. And we have application support to submit this application. We are conducting these webinars like today, and then there is a dedicated help desk. There is an email and a phone number which cities can call, and there is also a resource kit material which is available on the website, which you can download and use it. And the website also has all the material which is required to apply for the challenge. Right, these are the important dates. 5th of November, the application is opened. Now the application is open till 15th Jan. And then in the next 2 weeks, the applications will be evaluated and the cohort will be announced. So this is the detail of the next webinar, the workshop. Please do join. And yeah, that's it.
Thanks, Sree. So I just wanted to also note, sorry, could you mute maybe?
Yeah.
I was just hearing an echo. Thanks. I just wanted to make sure everybody knows also that that this session will be recorded or it has been recorded, and the recording will be available on YouTube and embedded on the website as well, along with the PDFs of the presentations. So we hope that this will be a resource for you as you begin the application process, also that you can revisit the video and maybe watch back this section and pause and go through each of the sections at your own pace. But this right now was our intention was to be able to provide you with an overview of the full application so that you can get started. And as Sree mentioned, please do reach out to the help desk if you have any if you need any support. So we are at the end of our time, but we did want to have some time for questions. So maybe if you do have questions specific to the application, I would ask that you put them into the Q&A box, and we will follow up on those in our next session, or we'll also incorporate them into an FAQ document and make sure that that's available. So please do enter those in the Q&A section. But there were a couple of questions also, I think, that were raised when Claudia and Ashish was speaking. So I would just want to ask a couple of these questions to the speakers. The first was about how we can increase positive interactions between babies and their working fathers. If either Claudia or Ashish, either of you have any ideas on this based on your experience, things that have been planned in your city?
Thank you, Nadine. I think, well, in Brazil, we do have a lot of barriers on that. And I think there is a cultural barrier. There is a difficulty for the fathers to be out there with the kids, because when they go to the park, for example, they only see mothers. So I think that the main thing is for us to identify what are the barriers so we can tackle them, so we can work with the fathers, with a group of fathers. We do have some interventions happening right now in Brazil and that we're trying to address. So I just think this is not something that is going to happen naturally. We will have to propose activities, to talk to fathers, to talk to mothers, to make group interventions so we can include them more as caregivers in the whole system. So yes, I could share some researches that we've done in Brazil, focusing in the barriers. I think the most important thing is to have the barriers clear so we can identify the strategies to address them.
Thanks for that, Claudia. There was also another question that was directed specifically to you about guidelines, the guidelines that have been translated. The question is quite open, about asking you if you could say more about those guidelines.
If I could say more about what? I didn't understand.
About the guidelines that have been prepared in Brazil.
Oh, yes. Yes, definitely. So I think Rushda could say even more because you were the ones who actually have done them. So there are 5 guidelines on policy framework, on monitoring and evaluation, best practices. The guidelines are available in the Bernard Van Leer Foundation website, and it would be better for you to use the guidelines that were not adapted because they are in English and our guidelines are in Portuguese. They're super interesting, and we decided to translate and to adapt them to Brazil because we feel that we see that there are a lot of, guidelines and frameworks that can support the leaders to actually implement the changes that they are planning.
And maybe I can add to that, Nandini and Claudia, to your response. So I just want to acknowledge that the guidelines were in collaboration with the Smart Cities Mission at the Ministry of Housing and Urban Affairs. And we had excellent guidance from the ministry and the mission in terms of what was required for these to be of use to cities in India. And it has 5 components, and the components are basically looking at why early childhood. There's a policy framework. There is there are design guidelines. There are evaluation metrics to really measure your progress. Also best practices from around the world, also from cities in India, as well as looking at gaps that may exist in some policies in cities. So these are guidelines. For now, these are not policy documents, but guidelines, but serve as a very useful guidance for cities. And this was the intention of the Smart Cities Mission, that it would be of use in terms of practical guidance to cities of what to do if you are to think from an early childhood lens. They are, I believe, on the Smart Cities SmartNet as well, where you can access them, and of course on the foundation website. Thank you.
Thank you. Thanks very much. Just one last question here about will the post-COVID phase alter the previously held assumptions about behaviors in public space? How would interactions be shaped in this the scenario that we foresee now, where maybe there are more there's use of more digital technology? Is this something that you're taking into consideration as you're thinking about projects going forward? Ashish, if you have any comments on this? Or Claudia, either. It's quite a big one.
So maybe Claudia can add. I just wanted to say that one thing that we saw during the lockdown, thanks to COVID, was a response to the earlier question that the fathers also started to take responsibility in spending time with the young children. This was forced, but this is something that we really saw happen on ground. And I feel that yes, the digital and technology solutions can add to what we do, but I think we already have a solution, a response mentioned in the chat box saying that it's the physical environment and the physical presence that would add to what we are aiming to do in terms of transforming the lives of young children. That needs more attention, and that can be added, supplemented with the technology and digital solutions side. So that's from me, but maybe others can add. Thank you.
Thank you. Thanks for that. If there are I don't see any further kind of broad questions here. And if there are specific questions about the application, again, please do share those or join us at the next session, and we'll have some more time then as well. So now I would just ask if Rushda, if you would close the session with some closing remarks and others who've joined us here.
Sure. Thank you very much, Nandini. I'll keep it brief. I know we are over time. But first of all, thank you to the Ministry of Housing and Urban Affairs, and of course to the Smart Cities Mission and all the panelists, especially to Mr. Lal Chandama, the Director of the Smart Cities Mission, who joined us today and opened the session. Of course, to my colleague Claudia and Ashish from ICLEI team, who spoke on behalf of Udaipur, and the Data and Analytics Management Unit at the Ministry, of course, the WRI team for putting this together, and to all the cities and agencies that have joined today's session and are interested in applying to the Nurturing Neighborhoods Challenge. The only thing I want to leave you with is to say that the challenge can be a very exciting journey, and of course, beyond the challenge as well, a journey that will give cities a new lens, and a lens perhaps from 95 centimeters, which is the height of a healthy 3-year-old child by WHO standards. And we've heard of excellent examples from Brazil. We were very glad to hear from Boa Vista and Recife, and of course, learn about the excellent work that's ongoing in Udaipur. And also last week, we heard from Pune and the Pune Municipal Corporation, and of course, Tirana in Albania as well. And these are all resources that, as Nandini mentioned, please look them up again, and we can provide more knowledge resources for you as well. We encourage you to apply and think about how your city can become friendlier towards young children and their families. This will, of course, not only help your city improve the quality of life for your youngest residents, but it will also allow you to improve the quality of life for all citizens. Because we really and truly believe that cities that work for babies and toddlers and their caregivers are cities that tend to work for all citizens, all groups. And with that, I thank you again for joining us, and we'll see you at the next webinar. I believe that's on December 4th, where we would be lucky enough to have Tel Aviv present, one of our Urban 95 cities, and also one of the first partner cities on Urban 95 in India. So we look forward to that session also. And with that, I will close and hand this back to you, Nandini. Thank you.
Thanks so much. Thank you, everybody. Thank you so much for joining, for staying on a little bit later than originally planned. And we look forward to seeing you at the next session on December 4th.